In family therapy, assessment of families is very important. So one of the assessments that are done frequently are family configurations. It's an important initial step, which is really to assess, who the family includes, like who's part of the family, and let's define the problem, and let's understand the different family members, and what does family mean to you, and, who is part of the family, like some family members might include, aunts, uncles, and cousins, but other family members may not include those people. So this is interesting. If you ask your family systems, who do you consider family, or who do you consider family? Some clients or some family members might yield different answers, and that may be the crux of the family. And so therefore, using genograms to check family configuration is very important. A genogram is like a family tree that incorporates detailed information about the relationships, the strength of the relationships, the fractured relationships. Usually has at least 3 generations. It's pretty systematic and standardized. Therapists can come up with their own codes if they think something is unique to the family system they want to look at. But generally, things like males are boxes and females are circles, and relationships and the type of relationships are delineated by certain lines, whether they're straight lines, dominant lines, broken lines. You could put 2 X's on a line if there's fractured relationships as well. But it certainly is a way to show the complexities of a family, and it is a constructive way for family therapists to try to build healthier alliances. So if they see that there's been some disruption in relationships between one generation of mother and child, then they can work on that. Or, grandmother and mother, then the therapist can kind of look at this generational trauma or issues that may have happened in the previous childhood of a parent, and then work on that, and then constructively start to rebuild healthy alliances with the immediate family of that parent and their child. Continuing on with assessment of families, you want to look at the family life cycle, and understanding the family life cycle will kind of understand, where families might exist. Now, understand that the family life cycle really appreciates, the developmental stages of families, but only those of families that are from, intact, middle class, American families, but these life stages help to conceptualize the evolution of families and where the families are at. So, for instance, families that are in the stage of somebody leaving home, or joining families through marriage, or families with young children, families with adolescents, launching, adolescent or emerging adults into their own adulthood, and launching children and moving on to midlife, families moving into middle age, families nearing the end of life. So there's a life cycle, and it has to always be modified to account for the variety of families. And what I mean by, again, I mentioned this before, but going back to the variety of families and the differences, like cultural diversity, divorced families, step families, single parent families, families with LGBTQIA plus members, families of blended ethnicities or religions, non-married cohabitating couples. There's a lot of different types of families as well. There's an extensive list of variations to the traditional family that I just mentioned. And so sometimes the CTS, the conflict tactics scale, can be very helpful. It's a structured and formal way of assessing abuse and violence within families. It assesses the treatment of partners by each other. How are people treating each other, partner to partner? How are children and parents or caregivers treating each other as well? It's 40 questions, takes about 15 minutes to complete, and it's a great snapshot of trying to understand the dynamics within a family. And then, of course, there's the therapy phase, and this is critical for family therapists to persuade the family that the problem is systemic rather than an individual, because many times in family systems, families will want to blame and point the fingers at one person and say, they're the identified patient, they're the identified problem. It's the member with the most obvious or problematic symptoms. And yeah, they may have obvious and problematic symptoms or issues, but really the goal of the therapist is to really say, look, this person does have some issues and problems, but it's only because of the result of the family system having been fractured and having complications. And many times families enter therapy with an identified patient, or only send one person to therapy and say, help fix them, because they're the problem and they're causing all the issues. And the therapist says, no. We might see the obvious symptoms here, but again, they are the result of a fractured family system. So let's all talk. Now, there are contemporary approaches to family therapy. The commonly practiced styles of contemporary approaches are narrative, solution focused, and multi systemic family therapies. We're going to take a look at those individually in the upcoming slides, but family structures have to be taken a look at very carefully as well. Salvador Minuchin, he emphasized, really to improve structures means improving functioning of individual family members. He said we have to look at subsystems. There's parental subsystems, right? The parents are subsystems, siblings are subsystems, and then the relationships between parent one and child one, and parent two and child three, right? These are all subsystems as well, and we need to pay attention to those to understand the functioning of the individual members. Boundaries have to be paid attention to as well. Boundaries have to be permeable to allow sort of emotional closeness, but also rigid enough for independence. Unfortunately, if families have boundaries that are too permeable, then they become very enmeshed with each other. So enmeshment is when these boundaries are too permeable and everyone becomes emotionally enmeshed with each other. However, family structures can also be very disengaged. If their boundaries are too rigid, then family members can feel disconnected and disengage. And this is where you see, lack of communication and distance within family members. Differentiation of self is very important, and this was identified by Murray Bowen, who also developed the thematic apperception test, which is a projective test. But he says that the primary task for each is to sort of self-determination. For healthy families, need to allow each person in the family system to be their own person, right? To individuate and to find their own individuality without sacrificing emotional closeness. So emotional bonding and closeness is still very important. However, each person needs to kind of individuate and find their own selves within the family systems. However, there are some families that are too emotionally fused or overly connected with one another and will never be able to differentiate themselves because of that fusion. And then there's also undifferentiated ego mass, according to Murray Bowen. You can tell that he was trained as in psychodynamic theory under Freudian perspective. But undifferentiated ego mass is when there's little tolerance for differences in feelings and belief of what one member thinks or feels. In other words, what one member thinks or feels, that's how I should say it. All members should feel the same way, and there's little tolerance for any deviation. Triangles are also very important to pay attention to in these contemporary approaches. When there's two people in conflict, sometimes when the family system gets fractured, a third member can be brought in to try to create an alliance. Like parents and children are recruited to side with the parent or to side with the child. And this is particularly a very unhealthy predicament for children whose parents are trying to bring them in and get them to side with one or the other. I mentioned those three different contemporary approaches, and so let's take a look at solution focused. Then we'll look at MST or multisystemic, and then we'll take a look at narrative approaches. Again, these three contemporary approaches to family therapy. Solution-focused therapy, did evolve from strategic family therapy approach. It's structured, it's positive-oriented questions. There's the emphasis on a quick resolution. So it's short, structured, with quick resolution. It is increasing in popularity as well in family therapy systems, particularly in more recent years, with people looking for more of a quick fix. Everyone says life is busy, things are moving fast, things don't slow down, but we need therapy. So solution-focused therapy is positive-oriented, seeking quick resolutions, and can be short and structured in nature. There's solution talk rather than problem talk. Solution talk is the goal of the therapist to frame questions and have conversations relating to solution-based focus and perspectives rather than let's keep talking about the problems. I hear your problems. Let's talk about solutions to that problem or issue. So there's not an overemphasis of conversation and discussion of the problem, but really an emphasis on finding solutions as soon as possible and making immediate corrections. Formula first session task is, any upcoming events or aspects that a person wants to continue to happen. They should focus on that in every day-to-day life. So sometimes it's like, what's coming up this week that you're looking forward to? Okay, great. that kind of excitement and fervor, or what you're looking forward to, then let's go ahead and incorporate that into your everyday lives. Exception questions. So this is like, well, when was this not a problem? When was it not so bad? And this is, again, taking away from focusing on the negative or, the problem talk. This is how we refocus it back into solution talk. These are the types of questions that you want to ask, these exception questions. Well, when was this not a problem? When did you have some good results from that? When was it not so bad? Right? And then you kind of reflect back to those positive outcomes and situations and try to find ways to get, or find solutions to get back to that. Then there's miracle questions. Well, if that particular problem somehow disappeared, how would your life be different? How could you get that problem to disappear to improve your quality of life, right? So this is, again, these miracle questions help you to stay more solution focused. And then scaling questions on a scale of 1 to 10. How bad has that problem been in the past week? Sometimes you might have clients or family members who are catastrophizing the issues. And so maybe they say, oh, it's so terrible, it's awful, it's the worst thing. Well, on a scale of 1 to 10, how bad is it? 10 being the worst. Well, I guess it's about a 6. Okay. And when has the problem been better? Maybe when it's been a 3 or 4. And then they talk about that. And how did you improve it at that time? What did you do differently? What was happening differently when it was a 1 or 2? What are some things you can do to get that, issue or problem that's an 8 or a 9 to a 1 or a 10? What things can you do differently? Again, solution-focused conversations, exception questions, miracle questions, scaling questions. Multisystemic family therapy is really designed for families with adolescents who have long-term behavioral and emotional problems. Many times they've also had some kind of a relationship with the law or some type of involvement in legal offenses. Cognitive therapy is used, behavioral therapy is used, parent training is used, solution-focused talking, and other kinds of therapy incorporated into MST at once. So you're going to see elements of that in this particular therapeutic approach. The overall goal is to improve family function. And when we talk about family functioning, it's not just within the family system, but also outside the family system, the community, what's happening in the school, improving relationships in the school, making sure the parents are communicating to teachers so that the children are maybe having better relationships with teachers themselves, having students and teachers having conferences, having students improve their relationship with peers. And ultimately, the goal is to reduce any antisocial behavior and to improve functioning, but not just within the family system, but within all these other systems that exist outside of the adolescent's immediate life: friends, school, larger community. All right, so narrative therapy is another contemporary approach. Narrative therapy kind of takes on the notion that, we construct our narratives about our own lives. We can construct a narrative of our past. We can construct a narrative of our present. We can construct a narrative of our future. And the ability to do this is a powerful influence on the way that we experience maybe new events, upcoming events, and maybe situations, interactions of other people. And so interpretations of the experience is done through language. And so sometimes a therapist might ask someone to journal, what do you expect to hope for the future, right? And if they write a narrative or even talk about the narrative about what they perceive their life to be in the future, then the therapist can help them do a couple of things. Number one, they can help to edit their experiences to fit sort of more of a reality storyline, and a reality storyline to sort of develop a storyline that is going to connect better with sort of the reality of what's happening. Sometimes these narratives, people can cast themselves as failures. And so then a therapist can help them once they read the narrative and say, well, you're really reading a narrative here, and it really makes you kind of writing yourself as the bad guy or as a failure. So let's edit this narrative and find a way that we can see how you can be more of a productive family member within your system and not feel like a failure, right? And so what can we correct and change? Again, so sometimes the therapist can read the narratives and say, well, how can we improve your sense of feeling bad or being a failure? Or how can we make sure that your narrative more aligns with what's happening in reality? So there's a lot of revisions and recasting of selves within these narratives. And once you kind of find the sort of fit of who you are within your written narratives or verbal narratives with your therapist, and the therapist will guide you towards a little bit more reality orientation, and that it's okay to be flawed, but we make mistakes, but how are we going to correct the mistakes? And again, revising, re-editing, and recasting kind of who you are. And then this can help the person kind of move forward in their lives, because if they've created this narrative in their mind of who they'd like to be, then they can make some of those corrections and changes with the use of those adaptive narratives. Family therapy, of course, always has to have cultural competency, as with any framework. So therapists has to be appreciative and accepting of different cultural backgrounds and families. This is extremely vital. Have to understand all these unique variables that exist within families. You know, you might partners together that are raised in different religious backgrounds or ethnicities. You might have 3 generations of families living together in the same household with 3 distinct different types of acculturation processes, right? Other ethical issues are confidentiality, very similar to group therapy. If one family member, maybe put in a phone call or asked a question or pulled the therapist aside maybe before or after a family therapy session, how does the family therapist deal with that? Do they hold on to that information as confidential, or is it something that feels very important that should be shared with everyone? And it could be a unique issue that can help to sort of unravel the fractured system and really kind of help the family work together. How serious is the information that was divulged? How trivial is it to the rest of the family? But ultimately, the therapist has to set ground rules initially in the process so they don't get stuck in that situation. So they should really avoid private conversations with other family members. But if it does happen, then they do need to pull the family member inside. Remember what you told me after our last session? That seemed really important, and I'd like to get your permission for you to perhaps maybe allow me to talk about that, or for you to broach that subject and bring that up. I can guide you towards that, but perhaps you might want to bring that up yourself and we can talk about it in the family therapy session. Or, may I open that subject up just enough for you to start talking about it? Ultimately, as a therapist, you want to avoid those private conversations and let the family communication and dynamics sort of evolve within that system. But there are ways that you would have to deal with that for ethicality. Other ethical issues is diagnostic accuracy. So this is a limitation really more of the DSM, the Diagnostic and Statistical Manual of Mental Disorders. There is pressure to assign diagnosis to qualify for payment, right, for healthcare systems and for managed care and insurance, right? They might require family therapists to assign some DSM diagnosis to at least one family member, and then the family therapist might feel pressured to do that because they want to work with the family and the family can't afford it if it's outside of the insurance. But unfortunately, the diagnosis may start to kind of generate and facilitate that identified patient idea, which can be problematic, and that identified patient can feel stigmatized. And certainly the diagnosis itself may be an ethical violations and even insurance fraud. But family therapy, how well does it work? Well, efficacy studies show that family therapy works, and it works well, about as effective as most of other modes of therapy. There are differences among family therapy approaches, but even those differences are typically insignificant when it comes to the efficacy in research. There are I just want to say, and specifically where family therapy has established success is with people, with just marital discord, schizophrenia, eating disorders, self-injury, delinquency, conduct disorders, disruptive disorders. And there are many financial benefits to society. So a lot of these therapeutic approaches, particularly MST, when you're working with adolescents who have had some type of involvement with the law and, violations of the law, it can reduce the need for taxpayer-funded additional services. So the more that we can help families become functional, it does have financial benefits to society as well as to the family members themselves. Thanks for watching, everyone.